Hello friends, let's today talk about the incidence of total hip arthroplasty dislocation. If you have undergone total hip replacement and you wonder what are the chances of dislocation, let's talk about it today. As per the national registry, the chances of hip dislocation within first year is around 2 to 3%. When we talk about the factors that increase the chances of dislocation are basically if it is a revision surgery. Revision in the sense that your surgery has been done twice. Also, when we do direct anterior approach, the chances of dislocation are less. However, if we do posterior approach and the capsule is not repaired properly, then also chances of dislocation increases if we are using posterior approach. Also, when we talk about other implant related factors, using a dual mobility cup reduces the chances of dislocation in long run. Also, if you have undergone a previous spine surgery and your spinopelvic joint is markedly fused, that means the spine was fused before total hip replacements was done, then also the chances of dislocation increases. This is known as hip spine syndrome. When we talk about patient-related factor, there are few patient-related factors also that might increase the chance of dislocation post-surgery. These include advanced age, neurological disease, rheumatoid arthritis, or if the patient is extremely obese, or if there is osteoporosis, or if there is abductor deficiency. Abductor deficiency means the muscle that supplies power to the leg to take the leg out. That is known as the abductor. We have already discussed about the posterior approach. If we are not pairing the posterior capsule or external rotators, that also lead to increased chances of dislocation. When we talk about component placement means basically if you have talked about the malposition of the implants put in your body, that can also affect the rate of, or that can increase the rate of hip dislocation after surgery. Like malpositioning of cup or stem can increase the chances of dislocation. Impingement, that is the obstruction of movement due to implants or bone or implants pressing each other while movement, this is known as impingement. If that is happening, that can also increase the chances of dislocation. Also, when we talk about the components, the head size also matters if you want to reduce the dislocation. Larger head sizes like between 36 to 40, they lower the risk because the jump distance increases. Also, dual mobility implants, they reduce the risk of dislocation. If we are going for revisions or if we are using constrained liners, then also the results are better. So practically, if you are planning for hip replacement surgery, don't worry, just choose any doctor who has been doing hip replacement routinely, and if he is doing a good job, if he is putting the implants in proper position, if the proper approach is used, if proper soft tissue coverage or repair is done, and also there is no previous history of spine surgery, or if your muscles are working well, there is no abductor pathology, don't worry, your surgery is going to be a successful surgery. So overall, chances of hip dislocation after a hip replacement surgery are really less than 3%. Is that what literature tells us? But to make it a successful surgery, there are few factors related from patient side, there are few factors related from doctor's side. So combined together, if the patient will also take care, if the doctor is also thorough during the surgery, then you will have a stress-free and dislocation-free life later on. Thank you.